Hi, everyone, and welcome to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my colleague, Sarah Yanosy.
Hi, Sandy. Hi, everyone.
Hey, Sarah. Sarah and I have developed an organizational intervention to help organizations to become trauma-informed using the acronym PRESENCE. We use that word and its letters to represent partnership and power, reverence and restoration, emotional wisdom and empathy, safety and social responsibility, embodiment and enactment, nature and nurture, culture and complexity, and emergence and evolution. So this broadcast, we want to talk about and focus on relationships and recovery. So let's begin by talking about the 4 areas of functioning that exposure to trauma and adversity can really interfere with.
The first one is emotions, identifying them, managing them. When people have been exposed to trauma, adversity, or chronic stress, emotions become really hard to manage. We also see trauma exposure interfering with our thinking. Specifically, I think about making decisions. We also have difficulty with change, making transitions, following routines. And the fourth area is social skills. Thinking about how you affect other people and how you engage with them. Sandy, will you say a little bit more about what these look like, these 4 categories, and how we might recognize some of the challenges that show up?
Yeah, I'd say number 1 is the problems with emotions. And that can look like high anxiety, having trouble managing any kind of distressing feelings at all, being chronically irritable, not really knowing why. It can lead to having trouble empathizing with other people. You cut off your own emotions so much that it's really hard to empathize with others and appreciate other people's points of view. It may be hard to do your job, may be hard to really persist with challenging or effortful or tedious tasks because you have a really low frustration tolerance. So, there are some days that I've been really stressed out and the kitchen's just a mess. And I walk into the kitchen intending to clean it up and I go, I really just can't be bothered right now. It'll have to wait.
Yeah.
Because it's just one thing too much. Expressing concerns, needs, thoughts in words, but can be really difficult when your emotions are aroused.
Yeah, I think a lot about my work with young people in a school setting. And one of the things that I saw all the time with kids who had a lot of trauma in their histories was this need to feel intense emotions. Like calm was really actually uncomfortable for them. So they would kind of walk into a room, everything would seem, okay. Kids were working at their desks, doing what they needed to do. And, one kid would come in and just sort of like knock things off somebody's desk or hit them with a pencil or a ruler and really create a lot of chaos. It would sort of feel like a tornado every time they walked into the room. And I came to really understand that as the need for adrenaline. Like there was it was not comfortable to feel calm when emotions were not high. That was discomfort. And that it makes sense biologically when we think about what happens to the brain.
Right.
But it is, it's really hard to be around.
Very hard. And teachers have to contend with that all the time.
Yeah.
So how do you, bring the temperature down when you've got a whole classroom of children that are going from 0 to 10 over seemingly nothing, right? They're just out of control.
Well, and also, when people who are struggle with emotion management because of their trauma exposure, they often are really attuned to other people's emotions, and I call them spongy, where they absorb other people's emotions and start to enact them. And so we see that a lot too, with people who've had that trauma history.
That's a brain thing too, because we
Yeah.
all have mirror neurons. So we last week we were describing the still face experiment, and the mother and the child were interacting with each other, and the child was mirroring the mother and vice versa, because we have these parts of our brain called mirror neurons. And so it makes emotions contagious,
Yeah.
very contagious. We're designed that way as human
Yeah.
beings.
Yeah, for good reason. But sometimes that gets in the way. Problems with thinking. What does that look like?
That looks like a lot of different things, right? Having developing cognitive biases like nobody likes me, you always are blaming me, I'm stupid, I'm the smartest kid in the room, all of that. Trouble understanding what is actually being said. Uh, Trouble doing things in a logical sequence. So people that are, they can't seem to get organized. Seeing things that are in between, seeing grays instead of seeing the world in extremes of black and white. Working with time. So lots of people who have had a lot of trouble, have had a lot of trauma, have trouble being on time. It's part of the organizational piece, but they are always late. And they don't intend it to be, but somehow that's what always happens. Being able to reflect on different thoughts and ideas at the same time, which then leads to more complex thoughts and decision making. But if you can't do that, then that's a problem. Difficulty taking into account the whole context of a situation that you're in. Maintaining focus, all really hard.
Yeah, when you were talking about kind of black and white thinking and those cognitive biases, it reminded me how frequently um, we run across, people showing up with all or nothing thinking and overgeneralization. And I think that is sort of the foundation for why in creating presence, we created a whole category of skills for complexity management. I think we don't necessarily teach that to humans, in most of our settings, school included, and certainly not in our organizations. But being able to combat some of these challenges in thinking that stress, just chronic stress alone, can create, makes it so important for us to be able to instill some tools and skills in managing sometimes contradictory information, and just appreciating complexity rather than oversimplifying, because that is where our brains will go under stress.
Yep. And
Oversimplification.
part of that complexity comes in too, because kids and adults with these kinds of problems often end up being diagnosed with ADHD
Right.
and just may get treated, but without any further work into what is the origin of all this, because that may really make a difference in their cognitive function. And if you don't pay attention to these other issues that we're talking about, well, medication alone might not work as effectively.
It's funny when you're saying this, it makes me think, often our way of intervening is based on, one of these cognitive problems that you just described, right? Like not taking the entire context of a situation, when you're
Exactly.
making a decision, like, okay, let's just put a diagnosis and treat it with medication and hope for the best rather than,
Actually, that applies to the entire psychiatric system.
yeah, it does.
Sadly,
It does.
I'm a psychiatrist and it's embarrassing.
Yeah. What about social relationships?
It can really be a problem. I mean, if you can't manage your emotions very well and you can't deal with the context of a situation, it's likely to bring you problems in your relationship socially. So what you see is people who have trouble accurately assessing what's going on in a relationship. What are the social cues, kind of not seeing them or ignoring them or not knowing what they mean. Problems initiating a conversation and entering into a group. Problems just connecting with other people. So the result can be a lot of loneliness and isolation. We all want attention. Everybody wants to be attended to, wants to be listened to. That's normal. But for a lot of people who have been exposed to a lot of trauma and adversity, they don't know how to do that. So they get attention, seek attention in inappropriate ways that end up getting them actually into trouble. And because of all these problems, we also don't interpret other people's behavior accurately. So we don't get actually what's going on and have the social skills to address those kinds of problems.
I think a lot about how we tend to use the term attention seeking when we are criticizing. Usually it's criticizing someone's behavior, kids and adults, and how really thinking about it more as attachment seeking or connection seeking is so much more helpful for them and for us. I mean, I was in the car yesterday with my kids, and our 3-year-old interrupted every single time one of us as grown-ups started to talk to the other. And it's like, it made me want to pull my hair out. But one, I had to remind myself, like, okay, this is developmentally appropriate. And two, he doesn't get to see me all day long. We only have a few hours together. And so for him, it's not the most adaptive way of getting the attention and connection that he wants from me, because it makes me bonkers, but it's what he's got. It's all he's got. And so for me to really recognize, like, he isn't trying to be annoying. He actually wants to be part of the conversation. He wants to be included. He wants to feel that sense of belonging. And that really shifted my reaction and my mood.
I'm laughing because I'm thinking about my dogs.
Yeah, they do it too.
And
Yeah.
they can't tell me anything, right? So my big 10-year-old Belgian Shepherd comes over, sits, I'm at the computer, right? And she sits right at the edge of the keyboard and just stares into my eyes with these big brown eyes until I go, okay, you need to go out. I get it. And then we go. But it's so clear what the communication is
Yeah,
because she has
exactly.
good social skills.
Yeah. Yes, she does. Probably as good as, if not better than, my 3-year-olds.
Well, she's older. She's 10.
Oh, that's fair. That's fair.
Recovery, let's talk about that for a minute, is
Mhm.
about integrating all of these different experiences and knowledge and behaviors and making them really part of a bigger life story, getting a whole narrative. And there's some research around something that's called post-traumatic growth. There's a lot of talk in the environment about resilience. And I actually prefer the notion of post-traumatic growth. And it's defined as the experience of positive change that occurs as a result of struggling with highly challenging life crises. And at the same time, and it's why I'm a little uncomfortable often with the way resilience gets used, is that traumatic experience, by definition, changes people. If
Right.
it doesn't change you, probably wasn't traumatic.
And that idea of resilience, it almost implies like getting back to where you were. And doesn't really allow for recognition of that change or even the integration of that experience into
Right.
what you're taking forward.
Right. Exactly. And that's why I really prefer this notion of post-traumatic growth and the development, as Judy Herman first wrote about in her first book, a survivor mission.
Mm.
What is, I think, so inspiring about the human species is how many survivors struggle to make sense out of the absolutely senseless acts of violence that they have experienced, and then transcending its effect and transforming that energy, the energy of violence, into something that's powerfully good for themselves and for their communities. And that's what Dr. Herman has called a survivor mission. And, when you think about it really, and you really focus on that issue, um, nations have to do that as well, have to do that kind of work. And we're often quite reluctant to do that. We'll go bomb somebody instead. There's an author, Tina Rosenberg, and she studied traumatized populations in Latin America and Eastern Europe. And she wrote this. She said, nations like individuals need to face up to and understand traumatic past events before they can put them aside and move on to normal life. But it's a big question. How does a group, like a country, overcome the powerful dynamic we know as traumatic reenactment in order to transform the trauma into something that's better for the group and the individuals within the group? I think is a really big question.
From my vantage point, all evidence points to we don't want to. When I'm being most generous and my most trauma-informed self, I really try to understand movements that are working to suppress classroom teaching about American history regarding slavery and genocide of indigenous people as a trauma response of denial. But I think it gets framed, right, as trying to protect children from feeling bad about themselves and, having to experience the horror of those things. Um, but I think at its core, it really represents, to me at least, a maladapting coping mechanism for cognitive dissonance, right? Like, how can a country be so good and also have done such terrible things? And I struggle with this. And I think I've shared with you, my wife is an Army veteran. She's a combat veteran, actually. And so we have a very strong military connection and a lot of pride about that, and are really she's a social worker too. So a healthy amount of skepticism about institutions and systems, but that creates a lot of conflict, cognitive conflict, in really thinking about what we've done and who we are and how to put those things together. And so again, I think in creating presence, this is where those ideas about complexity management, right, which is all about integration. Complexity management is being able to take these conflicting things that we know or experience and weave them together into a cohesive whole rather than have to like deny one or the other. Rather than having to see something as all good or all bad, we can appreciate its complexity. Um, when I'm not feeling so generous, but still trying to be trauma informed, I get really upset that we are trying to, uh, cut out these really important parts of American history in when we're teaching children. And I think it's important to be developmentally appropriate and when we introduce these concepts and how and all of that. I mean, that seems like a no-brainer. But to leave them out completely feels really like we're preventing an opportunity for integration and healing of our country's historical trauma. And it makes me think about Maya Angelou and, her quote, which I won't read, but will paraphrase, which is about, when we know better, we do better. And so we have to know in order to do. And I think that applies to all kinds of situations, including, not our country, the organizations that we work with, our families, and ourselves as individuals.
These are examples that you're talking about, really, of how the country has been involved at a um, policy level in the past, in creating moral injury, creating a morally injurious culture. And I think that's the level that we're trying to pretend doesn't exist when we aren't going to teach it to children. It happened and it was bad, and we don't want to repeat that again. So the denial and the suppression of information makes it more likely that reenactment will occur, that we will continue to do morally injurious things as a whole society. And that doesn't make any sense.
No, and we see it too in the organizations that we work with when there have been real moral violations, perpetrated by a particular staff member or even the whole system. Mistakes tend to be shunned, and we want to forget it and move on as quickly as we can, and we don't ever want to talk about it again. And that really creates secrecy, which we know is a totally toxic, um, you know, phenomenon dynamic when we're talking about healing or recovering from trauma. And so when we pretend something didn't happen, then it's even harder to help people recover from it, if we're unwilling to talk about it or look at it.
Well, and it predicts it's going to happen again.
Exactly.
That's the really terrible part, is that we know from individual trauma survivors that healing and recovery means you have to put it all into a narrative so that the past can be metabolized, basically, and it really can become the past. Until you do that, it's still haunting the present. And so the more people try to suppress this knowledge about what really happened in this country, then the more likely we are to keep doing it over and over and over again. It's astonishing that people don't recognize that, right? That there isn't a systemic way of recognizing that it's a really bad thing to try to suppress history.
Well, and other
Stings.
countries have done it pretty effectively. I mean, I think about we've talked about how it looks in Germany, how it looks in Australia and Canada. And so there are some models for
Yeah.
it. And I think our work in creating presence is to use, and they're not perfect, and they are, they're flawed, and there are sometimes, challenges to implementing that kind of acknowledgement, but it's a start.
Yeah,
And
it is. And I've been watching a German detective show, and even in the scripts, they managed to look back at the Nazism and how that happened and the dangers of authoritarianism. And it comes out in the script so that people, it's just part of metabolizing what went on. It's amazing.
and that's how we transform trauma, by doing that metabolizing, um, and allowing that integration.
Individuals, families, organizations, communities, and whole countries can transform trauma. There are many ways that human groups, led by inspiring leaders, have transformed traumatic personal and political experiences into movements that actually change the world for the better. And they all represent examples of positive transformation. So I'll give you a couple, and then we can take a break. Bearing witness to awful events and seeking justice. Rescuing people, whether it's animals, people, animals, or rescuing the earth. Providing mutual self-help, like all the AA, NA groups. Educating to prevent more tragedy, real prevention. Taking political action of any kind that will stop extremist and destructive political behavior. There's all kinds of ways, and of course the arts of transforming trauma.
Yeah, actually, I worked with a patient a number of years ago who she never actually shared her trauma with me. She said it was unspeakable. So she never shared it verbally, but she did these incredibly powerful paintings. And they were so moving and so just incredible that I asked her if I could use them in teaching the trauma class I teach for social work at Fordham. And so her paintings have been part of the education of probably at this point 200 social work students. And I feel like that is such an amazing contribution that she's been able to make. And she and I are still in touch periodically. And that's been a really powerful part of her healing too. So thank you for listening to Creating Presence. We're going to take a quick break. And when we come back, we'll continue our conversation about relationships and recovery.
If you want to develop a trauma-responsive culture within your organization, your leaders must be able to be knowledgeable and possess the skills to create positive change. Creating Presence, developed by world-renowned Dr. Sandra Bloom, offers an online training and coaching process that will help leaders become capable to cultivate a safe, productive, and values-aligned environment for your staff and clients. For more information, go to www.creatingpresence.net. Creating Presence is managed by Lakeside, your resource for trauma-responsive care.
Welcome to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my colleague and co-host, Sarah Yanosy. We've been talking about post-traumatic growth and making a moral commitment and the importance of that.
Yeah, in our previous episodes, we've talked about how reliant we are in all the systems that impact our collective social health on using a medical model. And we've talked about changing the fundamental question from what's wrong with you to what's happened to you. In this segment, we want to apply similar thinking to ideas about recovery. And we often think about recovery from trauma as being about eliminating or reducing symptoms, and not as much about what psychological health really is. So let's talk about that, because that's where we want to go.
Absolutely. And there's a big difference between normal, in quotes, and what psychological health really means. I'm going to talk about what psychologically healthy people can do, right? So psychologically healthy people are empowered to make decisions for themselves and can share power in relationships. They can follow their own moral values and make a moral commitment. They have a full range of age-expected feelings and thoughts. We talked about that in the last section, how important that is. They can resolve conflicts without resorting to violence of any sort. And when we talk about violence, we mean it multidimensional, right? Physical, psychological, social, moral, and cultural forms of violence. But what that ends up being is that psychologically healthy people, since they can resolve conflicts, they can keep from causing harm to themselves or to other people. They have satisfying relationships and have a pretty clear sense of who they are and what's important. They're able to manage their impulses. We all have impulses, not necessarily lofty ones, that we have to manage, and they can manage those in a way that's appropriate to the situation. And they can still function and can problem solve even when stressed, because everybody experiences stress and gets upset. And they're always interested in learning and growing. And let me just touch a little bit on the sense of moral commitment and maturity that we're talking, because I think it's so important and isn't talked about enough. And it's so important because so many people experience moral injury. So people who are morally committed and mature appear to have at least one thing in common, and that is they are really committed to a sense of personal and group well-being, and understand that any kind of moral injustice has to be converted into a community asset, not just a personal asset, and certainly not just to be seen as a catastrophe. Because we believe that it's really from traumatic origins that we are able to co-construct, or in some cases reconstruct, what is a healthier, less toxic civilization. So for us, I think moral maturity is really about those trauma transformations that we were talking about in the last segment.
Yeah, and the work of integrating trauma into our larger life story or community or organizational story. And I think that's why so many people who have trauma experiences are drawn to human service fields. Many of us who are doing this kind of work or any kind of helping work are drawn to do that because of our own experiences. But it's also why it's so important to attend to our own healing and recovery when we're working to help others. And in creating presence, we focus a lot on understanding the risks of vicarious trauma, but even more than that, really understanding our own identities, our own lived experiences, and how we're bringing that into our work. And the work of helping other people can be really healing. And I think that's a powerful part of why many of us do this. But we also have to have reached a level of stability and health in order to be able to be available to others in that way. And I think sometimes when people are coming to the work because they want to help others heal, but they haven't really fully done their own work, that can be a real barrier to helping and recovery, both for staff members and for the people that they're serving. So,
And that's why it's so disturbing when you hear these stories, and I hear them all the time from my students who are out in the workplace, about how incredibly stressed the human services organizations are, and the healthcare organizations and the mental health care organizations. I mean, they are really struggling just to do the work. And what we're trying to do with introducing creating presence is to kind of provide an overarching structure for thinking about aiming towards having a healthier, less toxic organizational culture. And that's why we use this acronym to try to really gather together what we think are from our experience. I mean, you and I have worked with hundreds and hundreds of organizations that are really struggling to do this well and to really take care of others with a lot of adversity in the environment that prohibits them and really inhibits them from doing that. So the creating presence values and trauma that we talk about are because they're informed by what we know trauma does to individuals, but to also large groups of people. So the creating presence values are really informed by what we know trauma does to people and to large groups of people. So the issue of why do we talk about power? Well, it's absolutely critical that we are helping organizations figure out how to use power in a non-abusive way, how to create true partnership with other people, because the abusive use of power is the source of so much suffering. We say reverence and restoration because our current worldview that we're all living with right now has really led us to disrespect that which really sustains and protects all life, and therefore all consciousness. Emotional wisdom and empathy we emphasize because we know how trauma interferes with people's capacity to manage emotions and with the group capacity to manage emotions. So to learn how to do that requires some skills. Safety and social responsibility, because we are constantly and compulsively reenacting patterns of really unsafe behavior. Embodiment and enactment, because as we've been talking about, from birth on, we are signaling what's troubling us, what's distressing us through our behavior, through how we embody what has happened to us. Nature and nurture is because, as we know, and we've been talking about in the series, from birth on, suffering begins in childhood at the hands of adults, all preventable. And culture and complexity, because we're so confused as a whole people about right and wrong, and what is morally right, what is morally wrong. We're struggling significantly with those issues, and particularly struggle when there's a conflict of actually things that are right, but they're in conflict with each other. And then emergence and evolution, because, when you really get down to it and you get out of denial, we are in danger of trying to stop our own evolution. And in doing so, basically end all life on Earth, which is, we don't think it's a good idea. And we're not going to
No,
just sit by and let that happen. That's not good.
Well, and when you're talking about ending life on Earth and sort of the catastrophic impact, it's really similar when we bring that down to a more meso level, and we're working with organizations in creating presence, because often, organizations in human services are like on this self-destructive path, and we've seen lots of them implode. And so creating presence is really our way of helping stop that cycle too. And it's interesting because some of the things that we can do when we're promoting psychological health in individuals are really similar to what we can do to help support psychological health in organizations. And the work that I'm doing in coaching with our organizations kind of fall into some really concrete policy and practice work. So, in coaching, we're looking at ways to really normalize that change is difficult, and identifying that there is going to be resistance to change. And rather than using kind of authoritarian and punitive approaches to trying to push people towards change, to engage them in different ways. So a lot of our skills are about engagement. We want to recognize stress responses and symptoms, both at the client level, but also at the organizational level, like really understanding that behavior is communication, and seeing the way that staff are responding or reacting to things really makes sense in the context of the human stress response. A lot of our work is also about transparency and boundaries, and sort of balancing that information flow. What do people need to know, and versus what is confidential information, and giving people the right amount of information for them to be able to do their work effectively and demonstrate trust. We also look a lot at safety assessment. This is one of the biggest pieces, and we have created safety assessments that can be used to evaluate client safety individually, family safety, but also really applying that to organizational safety. We also want to look at how we role model emotion management. And this is where I think our work with leaders becomes so important, because leaders are where most of the change drives from. And so having all of this knowledge and understanding about the human stress response and how it applies to organizations helps leaders navigate that more effectively. And so a lot of that work is what we're focusing on in our coaching.
Yeah, and the acronym helps. You need some short ways to think about that, right? So
Right.
for leaders, it's really what they need to do. What is their big job in terms of creating culture? And the P is they have to promote shared decision making. For the R, they have to promote and model, walk the walk of respect and healing from the past. With the E, they've got to promote understanding and compassion for the difficulties people have all the time. For the S, they have to promote safety, self-awareness, and teamwork, because our safety is really in group cohesion. They have to promote, for the E, for embodiment and enactment, they have to promote insight and demonstrate what it looks like to build consensus and empower people who are underneath you in the hierarchy. The N means they have to promote proactive instead of reactive behavior.
And this is why we focus so much on brain regulation skills, because for leaders, their brains are just as vulnerable as the rest of our brains. And so having those skills for brain regulation makes it possible to be proactive rather than reactive.
Exactly. And the C for culture and complexity is about leaders have to promote diversity, and they have to model how you deal with complex problems without oversimplifying. They really have to, their people are going to look to leaders and managers and supervisors to actually not let them go down the path of oversimplifying what is actually a complex issue. And the E of emergence and evolution, that's really about change. It's really about not repeating the past we were talking about before, but really aiming at and driving towards positive change. And that's a big role of what leaders have to do. I think in the organizational culture, it's something that most people just walk into in a new job. And they have to realize whether they can be the CEO, but it's very unlikely that they've created the existing organizational culture. It might have been created 100 or 200 years ago for that, right? And lots of organizations. So it's really important to evaluate a culture that you're walking into, whatever level you're at, if you really want to change things. And that's why we created what we call the OPTIC, right? The organizational presence of trauma-informed culture. It's a anonymous survey instrument that we use with creating presence so you can get information if you're in a leadership position about what are people really saying in your culture. You may think everything's great, and then you get this survey and go, ruh-roh. It's not so great at all. And then we try to offer tools that help organizations make better, more inclusive, more complex decisions and learn how to build consensus, which most people don't have any experience with building consensus. They really don't know how to do it. That's why our democracy is currently so threatened. It's because it's so rarely happening. And it takes some time to learn the different levels of consensus and how to really work together in a group and share powers. Quite challenging, and people aren't used to doing it.
Well, it's funny because I think, when we talk about what can be, I think there's a lot of excitement and encouragement, and often we get, leaders who are saying like, yes, let's do this. And then there's a moment of hesitation. And one of the worries or concerns that comes up is, are we going to trigger people if we are trying to use trauma-informed care? And like, what if we start talking about trauma, or even worse, our organizational problems? Is everything going to fall apart? Are people going to spiral? And I think, there's a lot of worry that, in my opinion and in my experience, is unwarranted, right? Doing trauma-informed practice is actually about containing and holding these emotions and integrating the experiences. I think, but the fear is often, that there's going to be trauma dumping, and that we're going to be asking people to, basically participate in therapy at the workplace, and that's, not what people signed up for, and that's not what people are signing up for when we're
Right.
doing, this work of creating presence. It's actually quite the opposite.
Yeah, I think you're absolutely right. I think it's a lot of fear about blaming and guilt tripping and opening up Pandora's box, right? That somehow, everything's going to be lost that's really important. And that goes, you hear that whether we're talking about the organizational level or the individual level, right? That we can't talk about that. Well, that'll happen somewhere else. Well, where is it going to happen?
Yeah.
One of the first things that we try to do is create some guardrails, basically, for having these kinds of conversations with clients, certainly about their trauma. And then what we do with organizations is not at all dissimilar in creating safety plans and emotional management plans. But what I hear over and over again is, well, what if we trigger somebody? And I think there needs to be some clarity around this issue of triggers. I think it's important for people to understand that triggers are important psychological signals for where the pain is. It's like when you go to a doctor and you're having some symptoms in your belly, and the doctor presses on a part, you go, ouch. Well, that's important information. The doctor needs to know that. Like, what's the ouch about? Look there. There's a problem there. It's the same with triggers. They provide really vital information they're coming from our nonverbal mind. So they're coming from a part of our mind that doesn't have words, but that does contain the pain and the suffering that people are having. So triggers really provide really important information about where the sore points are, what's happened in the past that still requires processing. There's still an ouch. So trying to create environments where nobody experiences triggers is, first of all, completely impossible. You can't know that ahead of time. And I'd say it's really not helpful and is really potentially harmful because it's a way of avoiding, where the pain is. So it's really important at the same time for the triggered person to listen to what their mind is trying to tell them, not to just ignore it. While it's at the same time, it's important for the people in the environment to be sensitive to what the other person is going through. If they want to talk about it, fine. If they don't want to talk about it, respect that. But it's the person's responsibility if they're being triggered to figure out, well, that's a symptom. I just did an ouch. I have to look at what that really means.
So it's really helpful, when we're thinking about doing this work, to have an understanding of what your own exposure has been. What are the things that you have in your lived experience that influence how you show up in the work? And it's important to know too, when we're treating patients, what have they been exposed to? What are the symptoms? How does that manifest? How does it show up in your body? How does it show up in your thoughts, your feelings? What are the things that are likely to, bring those feelings up? And then equally importantly, what are the coping strategies that you can use? So when you do, encounter something that creates an ouch, what can you do to manage that, right? Not to avoid it, not to, become overwhelmed, but what can you do to keep your reaction and response at an appropriate level for you? And then what do you need for help? What can other people around do that's helpful? And sometimes that's nothing. Sometimes that's offering a glass of water. But there are lots of concerns, I think, that we're going to bring up too much emotion for staff.
Yeah.
What are
and
your thoughts about that?
I'm not really sure that's possible, that there is such a thing as too much emotion, but being able to maintain emotional safety is vital in any environment, and it's everyone's responsibility. So if something is arousing a lot of emotion, it means everybody needs to utilize their safety plans and aim first at calming things down, turning the heat down. Everybody needs to recognize that, wow, there's something there we need to deal with and not avoid it, but we need to figure out a strategy to do that keeps everybody safe. And that's often a leadership decision.
Yeah, and we're doing this work in the context of a work environment, right? We are not, doing therapy. And so we often will share with participants in any training opportunity, or, before they engage with any of the learning content, to really go through a self-reflection, to think about, what and how they might share, where and when is the right time, how much to share, how little to share, or how to just be present and participate without sharing, to kind of think about, even if you're not verbally contributing, how are you reflecting and processing or integrating what's being discussed, and to create an environment, a relational environment, where all of those options are available and acceptable, and where the group can hold and manage, because that's what we're asking our clients to do. And so
Right.
yeah, if we're asking the people we serve to learn how to do this, then we are responsible to do the same.
Yes, absolutely. Yeah.
And creating presence gives a lot of skills and tools to help learn how to do that better. So thanks so much for listening to Creating Presence. Join us next week when Sandy and I will talk more about what it means to lead in a trauma-informed organization. You can reach us at creatingpresence.net or voiceamerica.com. See you next week.